A capsular pattern in the radio-ulnar joint points in the direction of an arthritis. The capsular pattern is pronation and supination, which is painful, but not limited. In fact, this is one of the few capsular patterns where we don't find a limitation. The patient reacts very well on intra-articular injection. A non-capsular pattern, for instance, can be found after immobilization, after a radius fracture, for instance, or numerous other post-traumatic situations. The capsular pattern of the wrists. You think of a traumatic arthritis, but perhaps something more is going on. Perhaps there's a fracture of the scaphoid bone. Well, in that case, there are several elements that point in that direction. First of all, you have the story of trauma. There is clear swelling. There is a capsular pattern, so flexion and extension limited in both directions, plus muscle spasm and feel. There is also a compression factor. That means that the passive radial deviation where you compress scaphoid is also quite painful. And finally, you have a positive palpation. So those elements make you think of a fracture of scaphoid bone. And it's quite possible that the X-ray is still negative for a period of time, but your functional examination already points in that direction. Another option is rheumatoid arthritis, most likely bilateral symptoms, also warmth, swelling, synovial thickening, or simple arthrosis. In the carpometacarpal joint of the thumb, so the joint between trapezium and meta 1, we could have a very clear arthrosis over there, but there also could be a traumatic arthritis, which is popular in, for instance, certain sports like basketball, volleyball, handball. And in case of a traumatic arthritis in that joint, you can do an intra-articular injection, but we can also do friction massage. But there is something particular over here. We have to friction the anterior part of the joint, and we also have to friction the lateral part of the joint. And frictioning the both, that is quite intensive. There is a special palpation trick to find the exact localization, but I illustrate that very clearly in the films on friction massage. Another ligamentous lesion is perhaps an ulnar collateral ligamentous lesion or a radial collateral ligament lesion, which is very, very rare. A lesion of the dorsal ligaments, I already briefly talked about that in the chapter on carpal subluxation. Yeah, and remember the dorsal ligaments, there are many of them. We have a proximal row, a middle row, and a distal row, and the fiber direction in each row is different. Yeah, the proximal is north-south, the middle is east-west, and the distal is north-south again. So we are going to adapt the direction of our friction massage, because it has to be a transverse friction massage, to the specific localization. There's also an option that there is a rupture of dorsal ligaments, and in that case sclerosing injections are really indicated and have very good therapeutic results. This is an example of a friction of the ligament between meta 3 and capitate. So the therapist is frictioning with his index finger and is sitting next to the patient. And when you friction, for instance, the ligament between capitate and lunate, that's going to be a north-south friction. The therapist is sitting in front of the patient.